Good morning and welcome to our webinar. I'm Dr. Caitlin Padati. I'm the State Epidemiologist and Public Health Medical Director for the Iowa Department of Public Health, and today we're going to be talking about the 2019 novel coronavirus, also known as COVID-19. Just a few housekeeping measures. Today we're going to have all of our participants muted throughout the presentation, but we do want you to ask questions, so please do feel free to enter those directly using the question and answer box on your control panel, and we'll be going through questions at the end of the presentation. We'll also be recording this session and it will be made available to you to be viewed afterwards, and you'll get that through a follow-up email. So we want to talk today about a little bit of the background on COVID-19 and the current epidemiology or patterns that have been changing sort of quickly. We want to share with you some of the traveler monitoring and healthcare screening work that public health has been doing. We'll talk a little bit about some of the planning recommendations for Iowa businesses. We're going to share some advice around international travel. We'll talk to you a little bit about communication resources, and then we'll go ahead and work through some of our Q&A. So when we think about coronavirus or COVID-19, coronaviruses really refer to a family of viruses. And they're named this way because there's some structures on the outside of the virus that almost resemble a crown. And within this family, there's some viruses that are going to infect animals, some viruses that are going to infect people, and a few that are going to be able to infect both. Now, we know that there are 7 types of coronaviruses that can infect humans, and 4 of those are actually very common. They usually will cause a self-limited mild to moderate upper respiratory illness, sort of like the common cold. Most of us have probably had one of these in our lifetime. And these are the common ones that at this point can be detected sort of at a routine doctor's office visit. Now, in addition to those 4, there are 3 coronaviruses that are more rare and can cause more severe illness. Those are going to include MERS, SARS, and the 2019 novel coronavirus, which is also now called COVID-19. So when we talk about COVID-19 and how this has emerged, this virus was first detected back in December of 2019 in Wuhan in the Hubei province of China. And initially, a lot of the patients that were identified had contact with a large seafood and animal market in Wuhan, which was suggesting that this had moved from animals to people. Now, since then, of course, we've seen sustained person-to-person spread in over 35 different countries. And we think that this is happening between people who are in close contact with one another, so that's about within 6 feet. And what we think is happening is really transmission due to droplets. So somebody who's infected would then cough or sneeze, and little droplets that would have viruses in them would land in the mouths, noses of eyes, or eyes of somebody who's nearby, and then make them sick. We do think that people who are most contagious are the ones who are most symptomatic. And it is possible that a virus like this could be passed by touching a surface or object that would have the virus with some liquid on it, and then somebody could touch their mouth, eyes, or nose. But this isn't thought to be the main way that this virus spreads, and in fact, these viruses in general are not particularly hardy. We think about sort of the emergence of this COVID-19 virus. It was first identified in Wuhan in the Hubei province of China. And this was associated initially with a large seafood and live animal market in Wuhan. So this was initially suggesting that this represented animal-to-person spread. Now, of course, subsequently, we've seen person-to-person spread across 35 different jurisdictions, and it's occurring between people who are in close contact with each other, and we're defining that as within about 6 feet. We think that this virus is spread by droplets, so that means that if somebody who's infected coughs or sneezes, little droplets can land in the mouths, noses, or eyes of somebody who's nearby and potentially make them ill. We think that people are most contagious with this virus when they have the most symptoms, and it's possible that this could potentially be passed by touching a surface or object that would have, liquid with the virus on it, and then touching your mouth, nose, or eyes. But we don't think that this is the main way that this virus spreads, and we know that these viruses in general are not particularly hardy on surfaces. So I wanted to share with you what many of you might have seen. This is an example of a dashboard reporting some cases, and this one is coming through the World Health Organization. And they're drawing on reports that are made by various ministries of health in the different jurisdictions that have been affected. So you can see, and even these numbers are a little bit out of date at this point, we're at just over 90,000 cases and over 3,000 deaths worldwide. We have seen some of the numbers out of China stabilize a bit, but unfortunately we're starting to see increasing counts in other jurisdictions, as you can see here. And again, this publicly available dashboard through the World Health Organization might be something that's of interest to some people. Again, I think it's just important to keep in mind that things are changing quickly. And there's this dashboard through the World Health Organization, and there's a similar one through Johns Hopkins University that you might have seen. And these can be helpful sources just to give a little bit of situational awareness. We want to sort of acknowledge here, though, that things have been changing quickly with this particular virus. This virus was really only identified last December, and in a relatively short period of time, unfortunately, we've seen, quite a bit of spread of this virus. But we've also seen a lot of collaboration from public health at the global, national, state and local levels to try and share some information and help people understand what's going on. And so, as we move through today, I think one of the big points that I'd like to highlight is we know that things are changing quickly. We know that there's a lot of information coming from a lot of places, and we want to make sure that you all know how to reach out to local and state public health for up-to-date and accurate information. So what you're looking at here is some of the information that's being shared currently out of CDC. And this information is talking about the case counts that we're seeing that are associated with travelers or that have been identified in the community. So that's at 43. And unfortunately, we've also had actually now we've had 6 reported deaths. So again, as you can see, this is changing pretty quickly. We've also got a chart here that's describing some of the testing that CDC is doing, and we've also got a table here that's describing cases among individuals who are repatriated from high-risk situations. So that would be Wuhan in China, as well as the Diamond Princess cruise ship. And that table is sort of called out a little separately from the other cases because it represents a little bit of a different risk group, so that's why you're seeing it described differently. And you can also see here CDC's map of cases of states that have reported cases. And this information is being updated, through the CDC every Monday, Wednesday, and Friday. Similarly, if you visit the IDPH website, you're going to find, information that we're sharing. So we're sharing individuals that we're monitoring through public health. So you can see the individuals who are under monitoring and individuals who have completed monitoring. And then you'll also see us providing the numbers of individuals who are being tested here in Iowa. And similarly, we're going to be providing these updates every Monday, Wednesday, Friday, but we remain flexible. If things change, we may adjust our approach as well. So we'll talk more about this sort of throughout this presentation, but one thing that I think has probably been on many people's minds and that I think is an important piece of this response right now is understanding which geographic locations are seeing continued spread or community spread. And so, the CDC's travel health notices have been the reference for this. And we'll include links at the end, but if you visit the CDC's traveler health page, you'll see the information that you're seeing here. And this is indicating that both China and Iran are at a level 3 travel health notice, which means that CDC recommends that travelers avoid all non-essential travel here. And there are also restrictions on entry to the US for these jurisdictions. You can also see that South Korea and Italy are at level 3, again, recommending that travelers avoid non-essential travel. We've also got Japan at a level 2 travel health notice, which is that older adults or those with chronic medical conditions should consider postponing travel. And then we've got Hong Kong listed at a level 1. And again, I want to acknowledge, I know this can be challenging because things are changing quickly and they may continue to change. And we're going to continue to share information as we get new information related to some of these geographic risk factors. But this will be important to keep in mind when we think about planning for us here in Iowa. So I want to turn it over now to Dr. Garvey, the Deputy State Epidemiologist and Public Health Veterinarian, to talk to you a little bit about some of the screening and monitoring activities that public health has been doing.
Thanks so much, Dr. Padati. So I'm going to take a few minutes and kind of walk through what we're currently doing with our public health and healthcare partners to both monitor people returning from mainland China and what healthcare providers are doing to screen patients upon presenting for care. So in accordance with the President's Task Force on Coronavirus, we are still screening travelers from mainland China. And the reason we're continuing to screen travelers from mainland China is because they've seen a high rate of illness being reported in that country. There's no plan at this point to expand that traveler screening to include travelers from additional affected areas because the rates of illnesses in those areas are significantly lower than what we're seeing in China. In a few slides, I will talk to you about what we're asking those individuals to do voluntarily, though, however. So for screening travelers returning from mainland China, the way this is happening is that flights from China are being funneled to 11 airports, those airports listed on the slide. And any travelers that have illness are being assessed by healthcare providers there at that destination, and they're receiving care or testing if appropriate. And they aren't allowed to continue to the destination until they've been fully assessed and COVID-19 infection has been either ruled in or ruled out. Anybody who's well is allowed to continue to their destination, and state health departments, so we're getting notifications from CDC through a secure communications platform that we use on a really regular basis. And they'll send us information for any travelers returning to Iowa, and that will include all of their contact information and where the timing of when they were traveling in China. We'll follow up with those individuals. We'll determine whether they're at high, medium, or low risk, and we'll work with our local public health partners to put those individuals under a public health order and do twice daily monitoring with them to make sure that they continue to be well, that they don't develop a fever or any respiratory symptoms. So this process is ongoing in Iowa. You saw the numbers on an earlier slide that Dr. Padati showed, and we update those numbers every Monday, Wednesday, or Friday. And again, those are just for travelers returning from mainland China. If someone was assessed to be at high risk, they're issued a high-risk voluntary home confinement order that requires them to stay home for 14 days after their last exposure to mainland China and requires them to follow up with their local public health department twice daily again to make sure that they stay symptom-free. If someone's at medium risk, it's pretty much the same requirements in that they're required to stay home for 14 days. They are allowed to go for a walk, go for a bike ride, do non-congregate activities outdoors, so jogging, those types of things. And someone at low risk would receive a public health order to submit to self-monitoring, which does not restrict their day-to-day movements. If they want to travel a long distance, then we need to give them pre-approval so that we can continue to monitor them when they're traveling. And again, they need to follow up with public health twice daily. I won't get into the details of what constitutes a high, medium, and low risk. If you're interested, that information is on CDC's website. But this is kind of the process we're taking with travelers returning from mainland China. Now, I mentioned that we're currently not receiving any kind of travel notification for people returning from the other affected areas. And by affected areas, we're saying those areas that have either a level 2 or level 3 travel advisory through the CDC. That's really what constitutes an affected area. And Dr. Padati showed you that slide earlier in the presentation that goes through the travel notices. And so at any point you can take a look at the CDC website and you'll know what we're talking about when we say affected areas. Again, any area that has a level 3 or a level 2 travel advisory. So for people that are returning from those areas, we are asking them to voluntarily isolate themselves by staying home for 14 days and monitoring themselves for symptoms. If they do get a fever or respiratory symptoms, we're recommending that they call their healthcare provider notify them of their travel prior to going into the medical office. And their healthcare provider can give them advice on whether their illness is serious enough that they need to be seen in the office, and if so, they can give them special instructions to be seen safely so that they don't expose others in the medical facility. So again, that's a voluntary recommendation. We are not notified of those people. So people coming back from Italy, for example, we're not notified of those people through our CDC notification. So we're asking them to voluntarily isolate themselves. All right, I'm going to switch gears and talk about the screening and testing that's occurring at healthcare providers across the state. So we've recommended that healthcare providers screen at or before registration. So this means when you call to make an appointment, asking these screening questions prior to coming into the office. Or if that didn't happen, then screening at point of check-in. And the questions we're recommending be used are, do you have a fever or respiratory symptoms? Did you travel from an affected area within the 14 days of you getting sick? And again, the affected area are the locations where we have a level 2 or a level 3 travel advisory. And did you have close contact with a person confirmed to be infected with COVID-19 in the last 14 days before you became ill? Again, I have the currently affected areas listed on this slide, but we expect that to change as this response continues. Right now, we're talking about China, Iran, Italy, Japan, and South Korea. So when patients screen positive, so when they answer yes to at least 2 of those questions on the previous slide, then we ask healthcare providers to use proper PPE, and that includes proper personal protective equipment, and that includes using fit-tested mask, gowns, gloves, and a face shield or eye protection. So then we ask the providers to go in and do a more thorough assessment of the patient. So doing things like assessing vital signs, getting additional information about when they became ill, when they traveled, what types of exposures they had when they were in the other countries, for example, and then we ask them to call us. And we'll walk through the testing criteria with the healthcare provider. So on this slide, you'll see a table that depicts the testing criteria. So this is what the patient needs to fit into one of these 3 categories in order for us to do the testing. And by us, I mean the State Hygienic Laboratory, which is a state public health lab. They do the testing here in Iowa. They have about a 24-hour turnaround time. And so they're an incredible resource for us and can get us really quick results if we have a situation where we need a quicker turnaround time. They're always able to accommodate that. So I won't go into this in too much detail, but just briefly, anyone with a fever or symptoms of respiratory infection and who had contact with a confirmed COVID-19 case would definitely qualify for testing. Anybody with a fever and respiratory symptoms and their illness is severe enough to require hospitalization and they traveled from one of the affected areas would again be tested, or anyone who had severe respiratory illness like a pneumonia or acute respiratory distress syndrome requiring hospitalization. If we didn't have an alternative diagnosis like influenza, for example, we would test those individuals as well, even in the absence of a travel or exposure history. So this is a testing criteria that we're using to determine whether Iowans can be tested for COVID-19. And again, we appreciate all that our healthcare providers and public health partners are doing to assess patients and work through the testing process. I'm going to shift gears again and start talking about our guidance specifically for businesses. Before we do that, we really want to talk about social distancing, because I think that there's some confusion about what we mean when we say public health may recommend social distancing if COVID-19 starts circulating in communities in our state. And social distancing is not simply restricting everyone to their homes. That's not what we're talking about. We're talking about things like potentially canceling schools or college classes, advising cancellation of events or large meetings, recommending that people cancel or limit non-essential travel, encouraging people to work from home if they have that option, and importantly, avoiding gathering together. So whether that's in a lunchroom or other areas, we just want to cut down on people commingling together and having close contact with each other. We want people, if at all possible, to maintain a distance of about 6 feet away. So for businesses that provide services like restaurants, for example, they could consider expanding their carryout services or moving tables further apart to make sure that people are abiding by like the 6 feet distance. Customer service, like cashiers, we're just recommending frequent use of hand sanitizers. We're not recommending wearing masks, but we do want them to maintain as much distance as possible when providing that customer service. We're getting a lot of questions about when will public health call for social distancing, and there's not a black and white answer to this. This is going to be a case-by-case decision based on the level of COVID-19 circulating in the community and the most up-to-date information that we have about the virus itself. As Dr. Padati mentioned earlier, this is a rapidly evolving situation, and we're finding out more and more about this virus as the response continues. So when we get to a point, or if we get to a point where we need to make a decision about whether we're recommending social distancing, we're really going to be looking at a number of factors. And so there's not necessarily a black and white step-by-step chart that says when this exact thing happens, we'll call for social distancing. But the bottom line is when we get an indication that this virus is circulating in the communities and making either large numbers of people sick or vulnerable people in our community sick, this is definitely a tool that we would consider using. And so we want to make sure that everybody understands what we mean by social distancing and has plans in place to respond to this virus appropriately. So I'm going to shift gears again, and I'm going to start walking through the planning guidance for businesses. Now, this guidance is posted on our website. Hopefully you've seen that. I'll walk you through how to get to our website here when we finish going through the slides so that everybody knows where to look for the most up-to-date resources. But again, I'm going to walk through this guidance just verbatim. So we're first going to discuss recommended strategies that we want you to take right now in absence of this virus circulating in our communities. So one of the most important things that businesses can be doing is actively encouraging sick people to stay home. So anybody who has symptoms should be staying home. They shouldn't be coming to work with a fever. And we want you to ensure that your sick leave policies are flexible and consistent with that guidance, and that employees understand that they're able to stay home when they're sick. That's, I think, one of the most important things that businesses can be doing right now is talking to your employees and making sure they understand how important it is for them to stay home if they're ill. That would also extend to any contract or temporary employees that work for your business that may not go through your HR department, making sure that those contract companies are also abiding by these non-punitive leave policies. We'd also encourage you not to require a healthcare provider's note for employees who are sick to return to work. We're saying that because we know there's a broad spectrum of illness with this virus. Some people are only mildly ill and can care for themselves in their home, while unfortunately others become more severely ill. So there may be employees that wouldn't seek healthcare, and we don't want to bog down the healthcare system writing notes for return to work. And again, we want you to keep as much flexibility as possible with the sick leave and family care leave, and permit your employees to stay home and care for sick family members, especially children. Again, like we mentioned, there's a big spectrum of illness with this, and a lot of people can just recover in their homes. And so you allowing your employees to take care of their sick children is going to lighten the burden on the healthcare community who really need to be able to focus on sicker individuals. If you do have somebody that gets sick at work, it's important that you get them separated from the rest of your employees right away, and they should be going home immediately. Other kind of common sense things that we can be doing right now is to make sure that we're doing everything we can to encourage respiratory hygiene, respiratory etiquette, so coughing and sneezing etiquette, covering your coughs and sneezes, and washing your hands frequently. So if you can provide tissues or no-touch garbage cans for employees, that's a good idea. Making sure that you have hand sanitizer with at least 60% alcohol is important. The preference is always to use soap and water to wash our hands for at least 20 seconds. But in the absence of being able to provide hand washing stations, we definitely would recommend hand sanitizers. And we would recommend that you do routine environmental cleaning. So pay a special attention to those frequently touched surfaces like the workstations, countertops, doorknobs, and you can use your normal cleaning agents. There's no additional disinfection that needs to be used beyond routine cleaning for COVID-19. Think about doing things like putting disposable wipes near commonly used surfaces so that employees can wipe these down before each use, like keyboards or remote controls or shared desks, for example. This is an important thing to be doing right now anyway. All of these measures are important because we are still seeing a high level of flu circulate in our communities. So all of the things that we're recommending that you do to cut down on the chances of transmitting COVID-19 are the same things that we recommend for influenza. So it's really important that we're taking these measures anyway right now, because as hopefully you all know, we're still seeing high levels of influenza circulating in our communities. Now, if you have employees that are traveling, we would highly recommend that you check the CDC's travel health notices for the latest guidance related to what type of COVID-19 activity and what other health recommendations are in place for those destinations. And as Dr. Bodotti mentioned, this is changing on almost an hourly basis, so it's really important that you're checking back frequently to make sure that you have up-to-date information. Know that if employees travel to areas where there's community spread of COVID-19, so those affected areas, public health monitoring or voluntary movement restrictions may be something that the employee is going to have to deal with when they return. And make sure that you're telling employees to check themselves for symptoms before they travel, and if they get sick while they're still in travel status, that they're notifying their supervisors. And again, isolating themselves when they're sick. And ensure that if they do become sick while they're traveling, they're promptly calling a healthcare provider for advice if needed. A couple of additional steps to consider is if employees are traveling outside of the United States, they really need to follow your company's policy for obtaining medical care. There have been a lot of questions about whether the embassies and consulates and military facilities can provide healthcare or help locate healthcare services, and that's not necessarily a function that they serve. So it's important that, again, your employees are following your own healthcare guidance when they're traveling abroad. So those are the things that we're asking you to do right now. In addition, we'd like you to review your emergency plans. And I'll talk through a couple of considerations in these plans here in the next slides. So it's important that you fully understand that the severity of the illness and the number of people who become ill with COVID-19 is really unknown. We don't know where this virus is going to spread. We don't know which communities, which areas of the country, which areas of the world are going to be hardest hit. So all of your plans need to be flexible and scalable. The impact may be more severe for people at higher risk, and that would include people with other health conditions, people who are immunosuppressed, and older adults. So keep that in mind as you're planning. And for the general public, So people who are not working in healthcare settings and who are unlikely to have some work-related tasks that increase their risk of exposure. The risk right now for COVID-19 is still considered to be low in Iowa and in most places across the U.S. So some recommendations for planning. We want you to identify any work-related exposures or health risks to your employees. If you do have some types of tasks that your employees are taking that would put them at higher risk, it's important to call those out and plan accordingly. Again, make sure that your human resource policies and practices are consistent with state and federal work laws. Prepare for increased numbers of employees to be absent due to illness or because they're caring for their family members. Understand that if social distancing is needed, daycares and schools may be closed, and so you would potentially have a high level of absenteeism for these reasons. And so you should monitor your absenteeism, implement plans to continue your essential business functions. In the case that you would experience higher than usual absenteeism, and it'd be a good idea to start cross-training personnel to perform those essential functions so that you can continue to operate even if your key staff members are absent. Again, explore and review all of your policies and practices related to flexible work sites and flexible hours. So if people can work from home, that's a really good option because they can then distance themselves from other employees. So teleworking is a great option if available, or staggering your shifts so you have fewer numbers of people in the office at the same time. You want to make sure that your IT infrastructure is able to support that many workers teleworking. So those are all things that if you haven't been looking into those, we would recommend that you do so. And assess your essential functions and reliance on others in the community to continue your business operations. So making sure that you are looking at your business practices, and you may need to change your practices to maintain your critical operations if you need to identify other suppliers, for example, or suspend some of your operations. We'd recommend that you identify essential business functions, jobs, roles, critical elements of your supply chain, and plan for how you'd operate if there is an increase in absenteeism or these supply chains are interrupted. Set up authorities, triggers, and procedures for activating and terminating your emergency response plan itself and altering your business operations, and making sure that business knowledge is maintained by key employees. This should all be part of your continuity of operations plans as well. And so if you have a separate continuity of operation plan, obviously you need to be looking through that as well. Again, plan to minimize exposure between employees and between employees and the public if we call for social distancing, and we talked about what that would entail in the previous slides, and establish a process to communicate with your employees and business partners about your plan and about COVID-19. And we all know that this virus is causing a lot of fear and anxiety and plenty of rumors and misinformation. And so if you have a sound system to communicate to your employees and business partners, that's helpful for you and that's helpful for us, so we can make sure and get good information out to Iowans. Again, we mentioned this, but in some communities, the childcare and schools may be dismissed. So determine how you're going to operate if you have large absenteeism. Again, local conditions are going to influence decisions that we make regarding these community level strategies. So we definitely want you to be reaching out to your other community partners to understand kind of what your local plans are. So your county emergency managers and your local public health departments are good partners to contact if you have questions. And again, if there is evidence of COVID-19 spreading within communities in the US, then you should consider canceling all non-essential business travel. And again, the CDC website and our website is a good place to look for that travel recommendations, and we all know that that's going to be changing really quickly. If we did have COVID-19 in our communities, we'd also recommend canceling large work-related meetings or events. A couple of additional points. If you are a business that has more than one location, we'd encourage you to provide your local management staff with the authority to take appropriate action. As I mentioned, recommendations will likely be community specific because we're probably not all going to be dealing with the same level of activity at the same time, and so we will tailor our recommendations based on what the community is experiencing. So it's important for those people on the ground to be able to take action appropriately. And again, this was mentioned already, but we'd encourage you to communicate closely with your local health departments to make sure that you're getting sound information, and work with the local health departments or our department to make appropriate action, to take appropriate action if there is a concern about COVID-19 in your workplace. If there was someone identified, we would be working with, we being public health at the state and local level, would be working with you to make recommendations. So we don't want you to feel like you need to decide what to do in response to an employee, for example, who tells you they have COVID-19 infection. We would want you to engage with public health, and we would walk you through what steps may need to be taken. At this point, I'm going to turn the presentation over to Polly Carver-Kim, our Communications Director, who's going to discuss some of the resources and recommendations.
Thank you, Dr. Garvey. I'll just take a few moments because I know you're taking time out of your busy day to talk about some of the things you have available for communication. And can you advance the slide for me?
You bet.
Thank you. That's good. You know, you may not have ever had to deal with the media before in your work, but you may start getting calls now as reporters work to localize these stories. We are always here. I'm always here to help you if you have any questions about the media. One thing, just a couple things I would tell you, if you do get media calls or emails, try to respond to them as promptly as possible. Even if you don't have time right that moment to speak with the reporter, at least acknowledge that you received their inquiry and that you're working to try to accommodate them, because they are also working to keep Iowans safe during this time. So we want to help them out with their job. As you do work with the media, try to avoid speculation and just talk about the situation as you know it right now. And of course, it's okay to acknowledge that you're not certain what tomorrow will hold, and you understand that some of your employees might be a little anxious about this. That doesn't necessarily foster anxiety or uncertainty, it just acknowledges it. And always be transparent about what you're doing within the confines of confidentiality for your business and also for the state. Speaking of confidentiality, at the state level here, we are releasing numbers of people who are being monitored, tested, and then the test results every Monday, Wednesday, and Friday. We're only releasing that information at a state level. That means that we're not saying somebody in Center Point, Iowa is being tested for COVID-19. We're just saying an Iowan. Because at this time, there's no benefit to releasing that information. There's no action we can tell the public to take as a result of someone being tested or monitored. And of course, as the situation changes, and if we need to give more information to Iowans, we certainly will do that to protect the public health. Next slide. We have a pretty robust social media here at the department. I encourage you to follow us specifically on Twitter. There's our handle, and our handle also on Facebook. We've been posting a lot of good information about COVID-19, and we encourage you to share and retweet those messages. If you go to the webpage that Dr. Garvey will guide you to here in a few minutes, we have a lot of infographics and all kinds of information that's available for your use. And if you start getting some nasty comments on your social media, I just saw one popped up on our Twitter page. Someone decided they were going to rewrite the intro to our COVID-19 webpage and gave us suggestions on what we should be saying to the public. You know, it's going to happen. And for the most part, just make sure you get the correct information out there and don't try to engage or argue with the folks who think that they're doctors. Because we have two of the best right here at the Iowa Department of Public Health. So I would say just provide factual information, and that's one reason why I encourage you to follow us on social media, because you can just send our stuff out. Here's a few of the examples of what's on our webpage right now that you can share and download and post in your buildings, whatever it is you want to do with those items. And finally, if you need any help, I am the communications director for the Iowa Department of Public Health, and I am here to help you. So if you need any assistance, feel free to reach out to me. I would prefer email or text because my phone is ringing pretty constantly, and that would be the most efficient way to get in contact with me. So thanks, and I'll turn it back now to Dr. Garvey.
Great. Thank you so much, Polly. So again, we have plenty of time for question and answer. If you have questions, please enter them in the question and answer box up on your control panel. While we're waiting for the questions to queue up, I'm going to just walk us through how to get to the resources on our website. So bear with me here while I get my screen shifted. Okay, so hopefully you're all seeing just a Google page. Not yet. Now you are. Okay, great. So our website address is just www.idph.iowa.gov. So if you go to our Iowa Department of Public Health main page, you'll see on the banner the COVID-19, and that will take you to our COVID-19 page, which has the numbers of people being monitored and tested. And if you scroll down, it has all of our recommendations for different partners. So the guidance that I just discussed is listed under business guidance. So we'd recommend that you take a look at that. In addition, we have other resources for other targeted partners, also for the public, for travelers, and then the communications resources that Polly mentioned during her slides. So again, hopefully you're taking a look on that webpage. We're updating things really, really quickly as the situation evolves, and so it's a good source of information. In addition, we direct you to the CDC website. Right on their main page is the coronavirus link, and for travel especially, if you just click on travel, that will take you right to their risk assessment information for countries that we're concerned about and for travel recommendations. All right, so at this point, we're going to transition to the Q&A portion. Just give us a second and we will start our discussion.
So it looks like we have a question about we're a retirement community. What are the considerations for assisted living, independent living, and nursing homes? This is a great question. And, you know, we've actually got an upcoming webinar directed specifically at long-term care settings that I think will also probably be helpful for you. And we can share that link as a follow-up to this, you know, the email that comes as a follow-up to this. And you're asking about, you know, should we request a lab test for people with fever or symptoms of infection alone, or test for flu first? You know, I think common things being common, certainly considering influenza, you know, we still have circulating flu. That's absolutely going to be an important thing to consider. But please do reach out to public health if you're having an outbreak of respiratory illness that you need a little bit of advice on, or even to report outbreaks of flu. And please do look out for that webinar. We agree this is an important population that we want to protect. There's a question, is there an infected by age and mortality rate chart available? So a lot of this, a lot of the available data, at this point has really come out of China because that's where many cases have been seen. And so the information that's available is largely through medical journals like the New England Journal or the Journal of the American Medical Society. So there is some information out there. But again, I think it just has to be sort of caveated by the fact that, we are still learning a lot, and different jurisdictions are having slightly different experiences and taking slightly different approaches. I can tell you that overall, it does appear at this point that the virus seems to be affecting people who are older with chronic conditions more severely, and that interestingly, children do not seem to be as severely affected right now. There's a question about having trouble finding hand sanitizer. I think that's an interesting question, and it's something that we'll probably be following up on. I'm not sure we've been made aware of people having trouble quite like that yet, and so we'll see if we can get a little more information for you.
The next question is related to food service establishments. Is there anything specific that we would recommend for those types of businesses? Again, we mentioned if you're a food service establishment, again, you need to be making sure that you're walking through all of your plans that we discussed on the previous slides, but then also considering things like increasing your carry-out business. That might be something that would be extremely helpful if we had a social distancing recommendation in place. So things like that, making sure, as with all businesses, you're making arrangements to allow your employees to maintain a distance from themselves and also from the customers. So nothing too specific other than just consider options for kind of being able to continue to provide services for the community and continue your business in that social distancing type framework.
There's a question here about what length of time do you think before this turns around, and if we change policies, how long do we do that for? And I want to take a moment to recognize we know that this is a lot of information. We know that we're talking about scenarios that can be scary or anxiety provoking. And, again, I want to look at the big picture here. So, as of yet, we have not identified a case here in Iowa. It's possible and even likely that we may eventually identify cases here. But what we want to do right now, and in having these conversations, is we want to make sure we give people the opportunity to think through some of the options and things that we can do that really, they sound basic. Some of these social distancing measures, staying home when you're sick, washing your hands, but these really are very effective ways to keep people healthy. And so they are important messages to share, and they're messages that you'll hear us share year round, because they're going to help against, whether we're talking about foodborne illnesses or flu or a variety of things. These are good public health measures. Now, with regard to some of the, the social distancing or, event, adjustments, that sort of thing, I think that it just remains to be seen. And I hope that we do a lot of preparation that perhaps we don't ever have to implement. But I think it's a good idea. It's prudent to be familiar with how we would implement these policies, and we're just going to need to remain flexible, I think, because things may change, and I think we'll just adjust depending on the level of illness and the needs that we see, that we have here in Iowa. So, I know this is hard. I really appreciate everyone's time and thinking through these things, because I think it's very important. And I think it's great to have these conversations and remain flexible. There's a question about are respiratory fit tests required for use of N95s? Yes, a fit test or fit testing should be done for an N95 mask use to make sure that it's appropriate. And again, there's no recommendation that anybody in the general public needs to use any kind of mask, including an N95. And there are specific recommendations for healthcare workers on how to appropriately use N95 masks as part of, the PPE procedure, but also recognizing there are other mechanisms in place that we can put in place, even in a healthcare setting, to help reduce the spread of illness before we get to PPE.
There's a question about whether there's any emergency preparedness tabletop exercises available for healthcare to use. Certainly there are plenty of tabletop materials available out there. We have not had the time to create something specific for COVID-19, but we would encourage you to reach out to your preparedness coalition. So reach out to your local health department and see if they can provide some type of assistance or tools that might be helpful for you to use.
There's a question about our schools being encouraged to have hand sanitizer in lunchrooms. You know, I don't think there's a specific recommendation for how to operationalize this, but the advice is now and will continue to be, you know, frequent hand washing with soap and water, you know, and hand sanitizer if that's not available. That's always going to be important, particularly before we put food in our mouths. So that's always going to be an important recommendation, and different places will probably have different plans for how to operationalize that.
A question about, with the 14-day period where people are asked to stay home, does this mean the incubation period is 14 days for this virus? And we're basing our knowledge of this virus on what we know about other coronaviruses, and 14 days has been something that we use with other coronaviruses, so that's what we've adopted for use with this response effort. As we know more about the virus, if that needs to be modified, it certainly could be, but at this point, that's the guidance that we're receiving nationally. So that's the basis for that recommendation.
And early data is suggesting that that is correct. So that's what we're continuing with. There's a question about how long does the virus live on surfaces. It's a good question. Coronaviruses as a group are not particularly hardy viruses, so we don't think that they live very long. You know, this is an example of a place where I think we do have a little bit more to learn about this specific virus, but for example, there's no concern about packages or mail or that sort of thing, and the routine cleaning of high-touch surfaces should be sufficient to address that. There's a question about, based on Iowans' low risk, but the fact that currency is often a means of transmitting a virus, do you recommend cashiers use protective gloves? It's a great question, and I think you're recognizing the ways that we know that germs spread. They spread when we touch things, right? Whether it's hands, whether it's money, whether it's cell phones. There's no particular recommendation that protective gloves need to be used, but what is important is frequent hand washing. So, making sure that, we're frequently washing our hands, using hand sanitizer, and certainly doing that before we would, eat or touch, eyes, mouth, nose. There's a question specifically about recommendations for a nonprofit serving vulnerable populations. That's a great question. If that individual wouldn't mind following up with us, maybe we can better understand what some of your needs might be, and we'd be happy to see if there's some material or support we might be able to provide you that would be more applicable for the population that you're serving. There's a question about CDC modeling and whether there's a prediction for when Iowa can expect to start seeing cases. Different institutions throughout the country and really throughout the world have played with different models to sort of consider how something like COVID-19 might move. There's a lot of variables to consider when we think about something like this, and so I don't think I have a specific time frame for you, but I would say that I think that given the way we've seen spread in other states here in the U.S., I think that this is our opportunity to think through, our response and take advantage of this time to do some preparations, and look forward for what the coming weeks will bring. But recognize that, again, we're likely going to have to remain flexible. There's a lot of things to consider about how something like this can move, and the control measures we're describing can be very effective measures to prevent something like this from moving through the community. There's a question about, is basic cleaning okay, or is a specific cleaner needed? No, just a regular cleaner that's EPA approved for the surface that you're using it on. And it's important to take a look at sort of the labels on the cleaning products you're using, because they'll tell you sort of how long that they need to be in contact with the surface, what types of materials are approved to clean. You want to make sure you're following all of that advice, but there's no special cleaner.
So there's a question related to whether we need to be concerned about packages coming from China, and the answer to that is no. We don't have any special recommendations for dealing with packages from China, and those aren't considered to be a health threat. The next question is a good one and one that we've been receiving quite a bit. So if an employee has a family member who's returning from Italy, and is there a recommendation for the employee themselves? So again, we are recommending that people who are returning from affected areas, which would include Italy, self-isolate for 14 days. And so they should be staying home, staying away from other family members, maintaining distance from them. And so the bottom line is we would not recommend anything for the employee, just for the traveler themselves.
There's a question about hand sanitizer that has an expiration. Does the effectiveness really expire? A great question. So, hand sanitizer, like many other things, will typically have an expiration date on it. Usually that's about 2 to 3 years. It's really related to the percentage of alcohol that's still in the hand sanitizer. And alcohol is sort of highly volatile, so it can evaporate. So, I think the best advice would be to not use an expired product. The product you have probably does still have, alcohol in it and helps, but it may not be up to that 60% level. So I think the preference would be to not use an expired product when at all possible. There's a question about, is there a specific recommended hand sanitizer or wipe for COVID-19? No, again, we're looking at hand sanitizers with at least 60% alcohol in them, washing your hands with warm water and soap, and using cleaners, appropriately in accordance with their label guidance.
Next question is, if there's activity in Omaha or Illinois, would we in Iowa elevate our alert level, or would we wait till there's activity here in Iowa? And really, these are going to be community level decisions. So we're going to be working with local public health, local emergency management in those communities where we're seeing activity, and make sure that they are aware of what's going on and that we're making appropriate recommendations for social distancing accordingly. Again, this is going to be a case-by-case decision. But certainly, if we're having cases in Moline or Omaha, right on the Iowa border, we're definitely going to be working with those communities to make recommendations. We aren't going to wait until we have someone on our side of the border to respond.
There's a question somebody was asking to see that social distancing slide again. We can scroll back to that. There's a question about, should we require employees to provide us with travel information even when it's personal travel? I think that's a little bit of an institutional question about sort of what policies that you can implement and what policies you might want to implement. I think certainly sharing widely with your employees what the advice is, to avoid travel to certain areas, to recognize that there could even be restrictions on returning to the U.S. from certain areas, and to recognize and share that, if you are in a certain area, we're asking you to self-isolate and think through what that looks like for your agency or institution. I think all of those are reasonable things to do.
There was a question about whether patients with COVID-19 are also testing positive for influenza.
Yeah, you're hitting on an interesting point here, right? It's possible to have more than one illness. That's certainly true. We're not aware here in the U.S. that there's been a lot of co-infection. I think there have been some case reports from other countries that have suggested that. And again, I think it's important to recognize that we do have tools to protect ourselves from things like flu. It's not too late to get a flu vaccine, and the more we can do to keep ourselves healthy and protected from, a variety of illnesses, the better. So it's an important thing to take advantage of.
There's a question about whether we have communications for faith communities, and Polly's, I'll turn that over to Polly.
That's a great question. We do not have that specific at this time, but we are working on that and hope to have something drafted today. And when it's posted, we'll post it on that website with a notification that that's what it's for, faith-based communities. So yeah, I would just recommend going back to that web page as often as possible, because we're posting stuff there all the time, and that is a priority, the faith-based community. So thank you.
There's a question about whether there's plans or methods to notify employers if a person tests positive for COVID-19. And if there was a situation where we were concerned about potential exposures within your facility, we would definitely be working with you to make sure that we're notifying people appropriately.
There's a question about whether the testing criteria for Iowa are the same for all states. Yes, we're following the federal guidance for when to test individuals. And again, this is an example of a place where I would say things have changed over time. They may continue to change, and we're going to continue to remain flexible, to make sure we're making the best use of resources to evaluate patients appropriately. There's a question here about 2018-19 flu caused about 34,000 deaths in patients, mostly 65 years or older. What do we think about the severity of COVID-19 in comparison to flu? Is it really likely that COVID-19 will cause this many deaths in a 2020-21 calendar year? That's a great question, and I think the real best answer is we don't know yet. Again, some of the early data around COVID-19 that's come out of China suggests that there's a mortality rate of between 1 and 2.3% in sort of the epicenter in Wuhan and Hubei. There was a mortality rate of about 0.7% for the rest of mainland China, and that compares to a mortality rate of about 0.1% for influenza. But again, it's an example of a place where I think, we have to say we've got more to learn. And we do think that this might affect, an older population more. But we also know that when we implement control measures, and again, they're simple, but washing hands, staying home when sick, staying away from others, those can impact those numbers. So, this is the time to make sure we're all familiar with how to do those things.
We have a couple of questions related to schools and what have we done to communicate with schools and how those cancellations work. And we have school guidance also posted on our website. We also had a webinar for schools yesterday. And so we are working closely with all of our schools and with our Department of Education to make sure that we're providing recommendations appropriately. And one of the messages that we conveyed during our discussions with schools yesterday were that we really recommended that they engage with public health before making any type of decisions related to school closures or event cancellations. And so that is something that public health would be engaged with. And the question specifically that we have today is, if school was canceled, should we assume this is a trigger for social distancing in that community? And I just want to assure you that if we're recommending social distancing for a particular community or communities in Iowa, we're going to be working with all of our local partners to make sure that that message is put out clearly. So you're not having to make assumptions based on school cancellations. We're going to be clearly communicating that we need all members of that community to practice social distancing. So I think that covers the school questions. The next question is, we're a large agriculture community. Is there any concern about transmission with pets and farm animals? And so we are not concerned about animals having any role with the transmission that's ongoing in the US. We are recommending that anytime someone is sick, that they isolate, or they're being monitored, they isolate themselves from people and from animals. Again, this is a new virus. Other coronaviruses have impacted animals, but there's no indication that animals are playing any type of a role in transmission. This is really being a person-to-person transmitted virus in the US. And but if you have specific questions, we'd recommend you reach out to us.
There's a question about recommendations for what to do if you need to travel, things like wearing gloves or turning off overhead vents. I think to begin with, I would just carefully consider where you're traveling to, and if it's possible to make alternate arrangements to achieve whatever the goal of the trip was. And if not, again, thinking about things like careful hand washing, certainly after touching surfaces and, before eating or touching, eyes, mouth, and nose, that sort of thing. But there's no need to be wearing gloves or masks or taking any additional or unusual precautions at this point. There's a question related to advice for nursing homes if hospitals would become too full to accept coronavirus patients. It's a good question. And again, this is exactly why we want people to start to think through their regions and their communities and who are the partners in your area through local public health, through your healthcare coalition, and talk about, options that you might have in terms of ability to share or borrow workforce, ability to manage patients in a slightly different setting. And I know those are hard. I know those can feel sort of overwhelming to think through. And again, I'm hopeful that we won't get to that point, but taking the opportunity to think about what that could look like would be valuable. And again, that's an example of a place where if we had, a facility that was needing help, public health would be working with you to help think through what some of those options might be. There's a question about, do I anticipate a coronavirus season similar to flu season? There already is a coronavirus season. So for the 4 very common mild coronaviruses that I mentioned at the beginning, we see those circulate each year, and it occurs around respiratory viral season, the winter, just like many of our other respiratory viruses. So it's possible, depending on the way that this virus ends up moving, and depending on what happens, I think it's possible that we could see it become a part of a coronavirus season. I also think there's some possibilities where we may be able to implement control measures or develop preventive tools like vaccines to help reduce something like that. So it's an example of a place where I would say, again, I think we've got a little bit more to learn and understand.
There's a question about whether we have any special recommendations for jails and prisons. And we're actually doing a webinar on Thursday for law enforcement partners that would include information on jails and prisons. And so that will be distributed this morning. So look for that information. We'll distribute that through all of our law enforcement channels. There's a question about, in general terms, what are the conditions that would need to exist for CDC or IDPH to recommend social distancing? So really it's COVID-19 transmission within the community. So activity within the community or indication of increased risk. Any concerns about airport employees needing to take extra precautions? Actually, there's really good guidance for airlines and airport staff on the CDC website. So it's right on that page that we walked through. There's a guidance for special audiences, I believe is the title, and there's airport guidance and airline guidance there. So we encourage you to take a look at that.
There's a question about, is flu A and B associated with COVID-19? Do we need to be extra cautious about COVID if we see people with flu A and B? There's not necessarily an association between flu and COVID-19 or COVID-19 and other viruses. I think that if you see the circulation of any illness among your employees, it's a signal that you want to take advantage of the things we've discussed, right? Encouraging hand washing, encouraging people to stay home, and just reminding people of all of those kinds of measures that are going to help, whether we're talking about flu, COVID-19, or a different kind of virus.
There's a question about what guidelines should be used for camps, and that's a great question as we get into the summer months. The question says, businesses are more like schools. I think that there's going to be good guidance in both of those pieces of recommendations that would be applicable. In addition, because it's more of a residential setting, if this is like an overnight camp, you might want to take a look at the long-term care guidance that's also on our website, because there'll be pieces of that guidance I think that will be helpful, especially if you have a health center at your camp, or it has guidance for how to deal with sick individuals. So again, pieces in all of the guidance that might be relevant for camp situations. There's a question about, if we are a public location for leisure, should we close to the public if we do recommend social distancing?
I think that's it's a great example of things to think through. I think it's an example of something that, again, local and state public health would be happy to work with you on. I think that what things like social distancing are trying to get at is we think that this virus moves when we're within 6 feet of somebody. And so if we can be, outside of that distance, then that risk goes down. And so again, I think it's good to kind of think through some of those things, and the advice on whether to sort of ask people not to congregate in groups or, be too close to each other. Those are steps that we want people to understand are a public health tool to prevent the ability of a virus to move from one person to another. But we would really be having, a lot of thoughtful conversations with people about when and how to do that.
We have a question related to a pastor traveling to Egypt with a layover in Italy this Saturday. When they return from their trip, should they voluntarily isolate themselves in their home for 14 days? So this is an interesting, go ahead.
Yeah, I think it depends a little bit on how much time you're spending in Italy and whether you're exiting an airport. So in general, our advice has been that if you're going to leave the airport and spend time in a location that has had community spread, so those locations that are listed as level 2 and level 3 travel health alerts for CDC, then we would ask if you could voluntarily self-isolate and monitor your symptoms. But if you're just passing through briefly in an airport setting, that wouldn't be necessary at this time.
We have a question of, is there a list of hospitals in the state that are capable of managing COVID-19 cases? And really, almost all of our health facilities would be able to manage a COVID-19 case. If they just need to be using the proper PPE. So this is a different response from some of them that you've seen in the past. There's not designated hospitals. All healthcare facilities should be able to manage a COVID-19 case, and we won't be directing patients to certain facilities.
There's a question about, from a legal standpoint, what questions can employers ask employees if they appear ill? This is a good question. I would hate to give you any sort of legal advice. You'd probably want to consult with your legal support or your institution or agency's own support internally to sort of clarify some of that. But I will tell you, and again, I know that these are hard conversations. I know that this is a challenging time, but I think being reasonable and sharing information and asking people, getting people to understand what it is that we're trying to prevent. In our experience, most people, are really on board with doing those sorts of things. But you may want to sort of clarify internally some of those legal details. There's a question, do you foresee COVID-19 being handled the same as H1N1 in 2009? That's a great question. You're right. You're using our last pandemic, the H1N1 in 2009, to think through some of how we may respond. And you're right. Again, this COVID-19 is a serious virus. We take this seriously, but these are the kinds of things we prepare for, and we've been doing it not just for weeks and months, but for years. And we do use experiences like that of H1N1 to help inform ways we share information and things that we can do. And so certainly, it would be reasonable if you had a document or some experience that you think you could learn from, for your own agency or institution. I think that's reasonable. And again, we'll have to adjust and be flexible to make things, COVID-19 specific, but that's a reasonable framework.
If an employee gets sick and is diagnosed with COVID-19, are there special precautions that need to be taken to clean the office space? Does a professional cleaning service need to come in? No. Routine cleaning is appropriate. Again, as Dr. Pedati mentioned, making sure that you're using proper cleaning supplies for the surface that you're cleaning is important, and following the label instructions, but there's no need to have a professional service in unless that's your normal procedure.
There's a question about sharing the symptoms for an acute respiratory illness versus a cold or a flu. So you're hitting on an important point that can be challenging. Sometimes a lot of those symptoms are going to overlap. So sometimes it will be fever and cough, and you might have those things with a couple of different viruses. And so again, that's why, we want to just encourage broad approaches to encouraging people to staying home if they're sick, and making people, allowing people to have that flexibility, because some of those symptoms may overlap. There's a question, is it advised that exposure of an employee to a person who is infected be isolated from
Work.
work? Again, if we were to identify an individual case that represented, potential exposure or risk to others, whether that's a work setting, a school setting, a personal setting, part of what public health does routinely, not just for COVID-19, but for all of the illnesses that are reported to us, we investigate whether there's risk to others and whether there's any protective measures that need to be taken. And so we would be working with you on that.
If this progressed to a more widespread event, how would we evaluate the risk of transmission from incoming mail or packages from areas that have community transmission? And the bottom line with this virus is it's not very hardy. It doesn't survive on surfaces like that very long. And so what's really driving this, the transmission, is person-to-person interaction, not any type of package type exposure risk. And so we don't anticipate having any kind of guidance for being concerned about packages from certain areas of the world or certain areas of the US. It's really more of an issue of making sure that we're staying home if we're sick, washing our hands frequently, covering coughs and sneezes. Those are the important things that need to occur now for influenza and for COVID-19 if it were to circulate in our communities. As a county employer, at what point should we start excluding visitors and customers from the workplace? So, go ahead.
Yeah, I think, this would be an example of a place where we would consider what's going on in your community, if we're seeing high levels of illness. And again, that would be an example of a message that we would be sharing, and want to share clearly and widely in the community to start to make those recommendations. So again, I think thinking through what that would mean for you in your courthouse, how you would do that, and sort of what that would look like is a good thing to do. But again, it would probably be related to how much illness is circulating in the community. And again, the idea here is just, we know that viruses like this move from one person to another. And so if we can reduce the number of interactions that people have between each other, we can reduce this virus's ability to move among us. There's a question about, are the people who are dying from this immune impaired or elderly, or are healthy people dying? I would say that for the most part, the cases that we've seen here in the United States who have unfortunately lost their lives related to this, they do seem to be people who are either elderly or with underlying chronic health conditions. There have been some case reports from other places in the world that involve younger people, but again, it's possible that this might be related to chronic conditions or behavioral health conditions. So at this point, we do think this is affecting, older people or people with immunocompromised more. But again, it's an example of a place where, we're still learning more.
A question about, are doctors' offices able to perform testing? At this point, the only testing that's occurring in Iowa is at our state public health lab, and that's being done in accordance with the testing guidance. In coming weeks, there may be additional testing available through reference laboratories, so healthcare providers may be able to send elsewhere, but at this point, it's just the public health system itself. Now, doctors' offices across the state are definitely able to submit testing for patients that meet the criteria. Healthcare providers are, again, have pretty detailed guidance on how to screen patients, assess them, and contact us for consultation. The next question is, do we have anything specific for fitness centers? And so I think that's a great question too. I think continuing your routine cleaning is important, and making sure that you have signs up that recommend washing hands frequently. You could think about putting hand sanitizer out, making sure that all of your cleaners for the machines is readily available, not reusing towels to clean the machines, that type of thing. Just the general cleaning recommendations that you're doing. You maybe just want to think about bolstering it and including some signage to recommend that if people are sick, stay home. cover coughs and sneezes and wash your hands.
Yeah, and again, I think this is another example of a really good opportunity to share, important health messages with your own internal staff and employees. I think the more that we share these messages and make these things clear for the people that we work with, I think the more helpful that is so that we can communicate good and accurate messages, whether it's our routine staff that are interacting with your customers, whether it's your environmental staff who are a critical part of, helping keep everybody healthy, taking the time to kind of make sure people feel comfortable and understand what's going on, I think is really important. And again, this is an area where local and state public health want to support you as much as we can. And we're not the only ones. You've got other resources available to you, for example, like the Safeguard Iowa Partnership and other folks, who we want to do what we can to help, support you in communicating these messages.
We have a question about if we have employees who are traveling personally for spring break, both in and outside of the U.S. in a few weeks, but are not going to any of the areas that have travel advisories. What, if anything, should we consider requiring of these team members upon their return? So at this point, we're really just wanting everyone to use those kind of common sense health measures that we've gone through. Certainly, anybody who's sick should be staying home, covering coughs and sneezes, and hand washing. There isn't anything additional that we would recommend for these travelers.
There's a question about the question between droplet versus airborne spread, and would long-term care employees need N95s? You're asking a very important question. I'm sure many of you have seen, there are some differences in how the World Health Organization classifies this versus CDC. We've been following the CDC guidance, which is to use airborne precautions and N95s in healthcare settings right now. I will tell you that, again, this could be a place where things may change, and we would be working very closely with a facility if they were experiencing challenges, because we want to be reasonable, we want to make sure that we're being safe, and we may have to adjust our approach, as we move along, but right now we are continuing to share that CDC guidance.
For libraries that have a lot of people using public computers, meeting rooms, circulating books, would we recommend attempting to wipe down those areas following each use? Any considerations for community public spaces? That's a great question. I think if there is the ability to do some extra cleaning, especially those high traffic areas, that's helpful. Even easy things like making sure you have tissues out in those public areas, making sure that you have hand sanitizer available. Those would all be good measures to take to cut down on flu and potential for COVID-19 spread. So nothing specific, just maybe enhancing that general cleaning, having hand sanitizers available, having tissues, and having wipes available to wipe those areas down quickly in between use.
There's a question about what types of home treatment are recommended, the same as flu. Yeah, so I think you're getting at supportive care. And again, we know that there are people who have mild illness with this virus. And so if somebody were to just be experiencing some mild illness, staying home, managing their symptoms, staying hydrated, those sorts of things are reasonable to do as long as that person is comfortable and doesn't have any underlying conditions or complications that they would be needing to reach out to the healthcare system for. There's a question, what is a good way to determine if an employee should return to work without a doctor's note? Should they be fever-free without the use of any fever-modifying medications? In general, our advice, whether we're talking about COVID-19 or a variety of illnesses, we certainly advise that you be fever-free for at least 24 hours without the use of any medications. The question of a doctor's note, we would discourage requiring doctor's notes, and the reason is because it just sort of creates a point of contact with the healthcare system that is probably not necessary. And so the more flexible we can be with our work from home and sick leave policies, the better. So I think that would be reasonable to consider. There's a question about what do you consider a high-risk task for employees. I think it depends on what employees you're talking about, whether we're talking about a healthcare setting or, traveling or that sort of thing. So if you have a specific setting that you'd like us to comment on, please just reach out and we can talk to you about that.
We have a question about cruises, and the CDC does have some guidance on cruises, but that they're related to cruises to areas of the world where there is ongoing transmission. So cruises to Mexico at this time don't present any increased risk over kind of air travel to Mexico.
There's a question about what is the likelihood that COVID-19 will infect a large population in the U.S. It was reported at one time through the media that this spread is in areas with not so great healthcare. Is that right? It's a great question. And again, it's an example of a place where, I'm not sure how quickly COVID-19 will move in the U.S. or how much of the population that it will end up affecting. But I do know that the measures we're talking about today, they are helpful and effective in preventing something from moving through a community. So the more we can do to share these messages and encourage people to take these practices, the less movement we'll see of a virus like this throughout our community. We have a question about, we have a non-alcohol industrial hand sanitizer. It's a metered foam. Would this be an acceptable alternative? There are circumstances in which some of those are acceptable. If that person wouldn't mind reaching out directly to us, we have a team of people that specialize in infection control, and they can talk to you about that foam and making sure that that's appropriately used.
A question about how long does it take for the lab to run a COVID-19 test? The test itself takes about 4 hours, and the lab is trying to have about a 24-hour turnaround time, 24 to 48. It's going to take longer to get some of the specimens there than it will to run the test itself. So that's part of the 24-hour accommodation.
There's a question about, can the virus mutate? If it does, do we know how quickly or likely? It's a good question, and sometimes viruses do have the ability to change things. Part of this response has been that many jurisdictions, the United States included, have continued to upload and make publicly available the sequences of the viruses that we've been detecting. So far, we do not seem to see very much change of this virus, but it's something we'll continue to keep an eye on. There's a question about, is this considered a seasonal type of virus, or maybe we will have to consider this the new normal? You're asking a great question, and I think it's a little bit too soon to tell. Again, it's going to depend in part on how effective some of the control measures that we take are going to be. So it does remain to be seen a little bit. There's a question about, is there a quantified number for large events and or meetings if social distancing comes into effect? That's a great question. We can probably, as that arises, we can probably work with you to come up with some more concrete, reference material to look at. But it would be something that, again, we'd be happy to work with you on to determine. There's a question about, why are masks not recommended to be worn? There's no need to be wearing masks for a couple of reasons. First of all, a mask is not necessarily, it's not necessarily going to be a completely effective control measure, particularly if it's not used correctly or if it's not the right kind of mask. And in fact, really the better thing to do, whether you have a mask on or not, is to wash your hands and stay away from people who are sick, right? Because those two things are just going to cover more of the potential ways that a virus could move from one person to another. So it's the advice is that we don't give that advice right now because it's not particularly effective, and in fact, we have other things that people can do that are more valuable.
So we are coming up right at our 10 o'clock kind of scheduled stop time. So we want to respect everybody's time today. We do have some more questions in the queue. If you have lingering questions, we'd encourage you to reach out to your local your local public health departments. They can hopefully provide some additional assistance. If And if they need our assistance, they can reach out to us. But again, we really appreciate your time today. We appreciate everything you're doing to prepare for COVID-19. Certainly, if there's additional guidance that you're needing, please don't hesitate to reach out. And we appreciate your time and effort. So have a good day. After this webinar concludes later today, you'll receive an archive version of this webinar. So you get a link that you can share with others or review if you missed parts of the presentation today. That will be sent to all registered participants. It will also be posted on that webpage, that the IDPH webpage that we looked at, and you'll receive a copy of the slides. So thank you again, and have a good day.